Welcome to Evacore Healthcare's Insight webinar series. My name is Matt Holmes, Digital Marketing Manager at Evacore. Evacore Healthcare empowers the improvement of care by connecting patients, providers, and health plans with intelligent, evidence-based solutions to enable better outcomes. If you'd like to learn more about Evacore and the solutions we employ to accomplish this goal, please reach out to sales@evacore.com for more information. Throughout 2020, Evacore has and will continue to host monthly, free educational webinars like this one that include guest speakers as well as Evacore subject matter experts to discuss today's most pressing healthcare topics. Today, we're excited to share an in-depth discussion about the current fertility coverage landscape and how market changes and the current patient experience are driving the need for broadening fertility coverage. Our conversation will be facilitated by Julie Westland, Strategic Account Director from Freedom Fertility Pharmacy. Julie, welcome to the webinar.
Thanks so much for having me, Matt.
Absolutely. Now, before we begin, just a quick reminder to our audience that all lines are muted, but you can submit your questions using the Q&A function in WebEx. It should be at the lower right of your screen. Questions will be answered at the end of the presentation. Don't worry, only the panelists will see the questions being asked. Finally, this webinar will be recorded and will be available on demand, located on the Insights page at evicore.com. All right, I think that pretty much covers everything. Julie, take it away.
Thank you, Matt. I'm so thrilled to be here today with this audience, Michelle Hatch and Kajal Patel. We have two amazing panelists that I would like to introduce to you. Michelle Hatch is the Director of Product Strategy and Innovation at Evacore Healthcare. In her role as Strategy Lead for FamilyPath, she brings her deep experience with medical benefit management, provider and payer integrations, and patient experience to the women's and family health space. A proven innovator and thought leader as part of the incubator team at Evacore, Michelle is known for solving difficult problems and aligning stakeholders as part of her mission to elevate patient care. A 9-year Evacore veteran, Michelle previously led clinical practice consolidation and growth initiatives for academic medical center institutions. Kajal Patel is the Director of Product Management for Freedom Fertility Pharmacy, a subsidiary of Express Scripts. Kajal is responsible for the development and implementation of innovative and responsive products and solutions to meet the fertility needs of both clients and patients. Prior to joining Freedom Fertility, Kajal served in several roles within the specialty and retail pharmacy divisions at a large chain specialty pharmacy as the fertility business owner. Her responsibilities included oversight and development of fertility strategies and execution of responsive and customizable go-to-market programs. She has more than 20 years of experience in the fertility field and earned her Bachelor of Science in Pharmacy from St. John's University in New York. This forum today is such a great opportunity for us to discuss the unmet needs in the fertility market and address some of the current gaps and challenges that exist. You know, for years, infertility and the challenges that many members encounter when starting a family have not really been an area of focus by payers. Members had no choice but to navigate fertility treatment on their own, encounter a confusing array of treatments and medications, as well as a multitude of providers when little or no benefit is in place, and that is not to mention the financial burden. Lack of access to adequate fertility coverage can cause significant implications for a family's mental, physical, and financial health. Every member's fertility journey is unique, and what works for one patient may not be the right approach for another. More and more plans are electing to offer fertility benefits because it allows them to ensure quality care, reduce complexity for members that are undergoing treatment, and drive down the long-term costs associated with fertility care. What we've learned is that by offering a comprehensive fertility benefit that's simple to navigate, many of the challenges can actually be addressed, along with managing the downstream costs associated with high-risk pregnancies. What we've also learned is that by creating and launching Evacore's new comprehensive fertility benefit solution called FamilyPath Fertility, we know that we can help members manage the emotional roller coaster that causes significant stress, as well as the financial burden placed upon members. And you know what? All of this leads to a happier member who can purposely move forward with peace of mind. So you may be thinking, why would Evacore be interested in offering fertility coverage? Well, because it's unquestionably the right thing to do for many reasons. Infertility is a disease, and fertility treatment should definitely be more accessible. A lack of coverage causes a financial burden on members. Members are struggling to navigate their fertility journey, and regardless of coverage, employers and payers are going to be impacted. A managed fertility benefit drives more successful outcomes and reduces long-term medical costs. And lastly, when it comes to fertility coverage, a richer standard is really becoming the competitive norm. Employers want to be proactive, and it's certainly a way to attract and retain your employees. Michelle, I'd love for the audience to hear your insight and expertise on the fertility market. So over the last several years, has the fertility landscape changed that much?
Yeah, thanks, Julie. I'm really excited to talk to this group today, talk a bit about what we've been seeing in the fertility market. I mean, you're right. It's incredibly evolving. And we've really seen a lot of activity in the past few years in the space. There are really three major trends. If we're going to kind of summarize what's happening in the market, there are three major trends that are driving demand and activity in the fertility, the women's health, the family health space. For fertility, a critical driver is the fact that states continue to add and expand mandates. 19 states now have some sort of fertility mandate. Others continue to have fertility legislation that's making its way through state governments. Just this year, Colorado added a new state mandate for 2021. Other states, like New York, continue to expand coverage underneath their mandate. So for New York, started with coverage for artificial insemination. Now they're expanding that coverage to include IVF. So there's this general trend to expand mandates, expand states adding mandates. You also see other states are continuing to expand the reach of their mandate to address issues of equity, and they're also expanding it to include additional treatment types, kind of similar to New York. I think we'll continue to see that expansion at the state level, and who knows, maybe we'll see an opportunity to expand coverage at the federal level as well. Really, the second critical trend that's driving the fertility market right now, and really that broader family health space, is the employer interest. So, these employers that have a highly competitive talent pool, or they're really interested in keeping employees, creating more longevity with their employees. There's a lot of interest in these types of services, in fertility benefits, in more of these family building benefits. They're looking for things that are going to drive loyalty within their employee population, and also help them, continue to be productive, effective employers while they go through some of these changes in their core family unit, or as they kind of navigate some of these healthcare conditions. So you see those employers proactively looking for solutions. In many cases, they're really rethinking the benefits that they offer. They're adding additional services on top of what their health plan's doing. They're going out there looking for digital solutions, anything they can to try to create some competitive differentiator for themselves in the market. And so really, these are the same ones. They're looking for more integrated provider models. They're looking for different ways of supporting and engaging patients. They're also looking for ways to better integrate care, overall for their members. So they're looking for opportunities to drive integration in their benefit. I mean, even with the current COVID-19 pandemic, we continue to see this employer interest. We continue to see, to hear that even with some of the economic challenges that we know many are facing in the market, they still understand that adding a fertility benefit and providing kind of these additional services to their employees are critical for maintaining that core of their talent and to continue to be able to competitively recruit talent for some of those critical roles. So in many ways, now more than ever, these types of services, innovation, additional support for building a family is needed now more than ever. And so really the third big major driver of interest is this growth of Femtech. And it's this real recognition of underserved or overlooked areas of women's health. And it really presents a huge opportunity for others to try to fill in the gaps. maybe drive benefit realignment. We're seeing some different incentive models out there that are emerging. We're also seeing this kind of growing recognition of women's role in broader population health as the primary decision maker for 80% of healthcare solutions. So it really makes sense for the market, and you're seeing that in the Femtech space and the investment that's occurring there, really focusing in on women's health and then, health conditions, health decisions that maybe disproportionately evolve or revolve around women out there in the workforce, out there in the market. So you're seeing a lot of new solutions out there in the fertility women's health space. I mean, in 2018 alone, almost $400 million was spent in the US on Femtech startups. I mean, just to give you a sense of it, that's the same investment out there for diabetes and oncology solutions. And I mean, we know how large those spaces are. So, many of the Femtech companies have started with this initial focus on fertility, but we're seeing that start to change, and more solutions are focusing on pregnancy, gynecological health, chronic conditions that disproportionately impact women. We're seeing kind of these new interests. They can be kind of sparkly, flashy objects. They're still trying to find their target audience. There's a lot of potential value out there. They're fine-tuning their business and operational models. And then they're looking for ways to really achieve scale and going through all those struggles. I mean, these players are incredibly critical because they really help create this driving force of innovation pressure and momentum with these employer groups. Is a critical kind of market driver there with these employer groups who are out there looking for these market alternatives. And with FamilyPath, we're always looking to the horizon for these emerging innovators and looking for partnership potentials. And we think that's one of the things from an Evernorth perspective that is a critical differentiator, our ability to partner with others in the market. So that's kind of a high-level overview. What are the critical market trends that we've seen? I would encourage everyone that's on the call today, if you see other trends or other areas where you would like some information, please feel free to submit that in the QA portion of the webinar.
Terrific insight, Michelle. That's awesome. So what are some of the challenges faced by payers in this evolving market?
Oh, that's a great question, Julie. As part of the FamilyPath journey, we've spent quite a bit of time doing various interviews with stakeholders, conducting formal market research, really focused on like what are the true needs, what are the true problems we're trying to solve in the market. And I'll talk a little bit about those, but again, definitely want to encourage everyone on the call or in the audience group to feel free to share your thoughts on what your challenges are that you're facing in this space, again, in that QA function of the WebEx. But really, what we've seen is there are a few critical challenges in the fertility and family health space for payers. Some of them are challenges payers face in other specialty areas. So, just general challenges related to the cost of care, the cost of the benefit, challenges related to administration of the benefit. Others are related more to market demands themselves, the fact that there are a lot of emerging models in this space. And others are due to the fact that fertility is unique and the fact that there's little to no Medicare or Medicaid influence shaping the market. So, providers in this space are used to operating and to some extent competing in this cash environment. So not in a fully managed care environment. And as a result, these fertility providers are both ahead of the curve for value-based type arrangements because they've had to be, and they're also kind of behind the curve for managed care. So, a lot of these providers have created their own treatment guarantees and risk programs where they bundle treatments and provide rebates based on patient outcomes. But I think we'll continue to see in the market some reshuffling of those clinics and some practice consolidation as coverage for these services continue to increase. And practices look to become more efficient to enter into broader value-based care agreements and managed care agreements. So we'll see a bit of that kind of evolving in the market. But really, when we look at similar challenges for fertility that are similar to other specialty areas, there's really the number one piece here is there's a lack of care standardization. There's wide variations in standards of care and quality for fertility. I mean, very similar in adjacent areas, right, within maternity and the broader women's health areas. There's a lot of care variation. Specific to the fertility space, that includes the fact that we still have some providers that aren't following a single embryo transfer. So making sure that you have a full view into providers that are effectively using single embryo transfer, and you're able to manage that within a network. That's an example of a critical fertility challenge. Others include, in the fertility space, some providers want to blanketly package pre-implantation genetic testing as part of their standard care approach, even though the latest evidence doesn't necessarily suggest broad adoption or coverage for pre-implantation genetic testing. And there are a lot of areas for opportunity. Another one includes cycle-based drug refill process, right? So a critical piece in the fertility management process is, you have a patient, they need a dose adjustment in the middle of treatment. And, sometimes the standard operating procedure at a clinic is to reorder the entire medication panel, creating kind of the significant waste in the process. And that's, and then there's even some patients who will then turn around and share some of that medication with other friends and others who maybe don't have access to coverage. So there's a lot of opportunities in that space to better manage care. In addition to practice variation, there's significant rate variation in the fertility market across providers. We've seen some challenges with our partners integrating general genetic labs into overall fertility contracting. We've also seen some out-of-date network contracts or problems with geographic coverage for fertility services. There's an interesting dynamic in the market where a lot of these payers, a lot of these providers have, significant cash pay business. So there's a bit of an art to negotiating with these providers to get them on board in more of a managed care environment. And we've seen some groups struggle with that, and it creates some geographic coverage problems for them. We also see with fertility, right, providers are becoming more used to a bundle payment methodology. We talked a little bit about how many of them are entering into some level of bundled or value-based care arrangements. But we see some payers are struggling with how to operationalize or contract with that approach. So maybe it's facilitating an episodic or bundled payment. Maybe it's the contracts themselves. That's a major challenge that we know that payers are facing, and similar administration challenges that we've identified through our market research and interviews includes things like claims automation. Fertility may not have had the focus that it needed before, and sometimes a lack of claims automation makes it difficult to broadly offer those benefits, or maybe there's a lack of focus on the fertility specific claims rules. So this also kind of goes hand in hand with the fact that there are no fertility specific insights from Medicare or Medicaid, right, driving the claims rules. So that's one of the reasons why it's so important to have that in-house clinical expertise helping drive the creation of those fertility specific claims rules. We also see payers in the space who struggle to streamline the medical management process. Sometimes they have a bit of a convoluted process between providers and the pharmacy and the medical management team. Maybe it's a manual process, maybe some challenges applying specific clinical criteria, or they struggle with the in-house specialty expertise to support management. So, things like having a reproductive endocrinologist in-house, genetic testing expertise in-house, and even in the fertility space, urology expertise in-house, So these are kind of traditional challenges, right? When you go really deep in a specialty area that we know that some of our payer clients struggle with. But there's some more traditional challenges too. I mean, we know that plans are faced today with a lot of that activity and noise related to the merging models and solutions that we talked about. We know employers are coming to them on a regular basis, asking them to partner and integrate with other solutions. And it can be pretty challenging. I mean, many of these emerging solutions are still unproven. They're working on making their case. It can be challenging to understand what's really viable, what's scalable, what's the cost of integrating with someone who doesn't do it over and over again with a payer and they're still kind of learning how to do it. And then we also see some struggle around hidden fees. We talked a little bit about some alternative incentive models, and sometimes those aren't readily transparent because these emerging solutions have kind of this broader roadmap in terms of where their future revenue opportunity lies. So there's a bit of kind of confusion in the market. There's some challenge navigating that in the market, and we know that creates a good bit of noise for our partners. We also found in our research and interviews that payers are struggling to address the demand for more patient-centric, fully integrated fertility benefits. So trying to eliminate some of the silos between medical and pharmacy and really make it more of a fertility benefit. And sometimes that's because of structural or system issues, and there are challenges supporting those additional value-added services that employers are looking for, with like patient concierge type services, support for adoption, surrogacy, those types of services. But really, if you were to kind of summarize it, I think the biggest challenge in this market, in the women's and family health space, fertility space, is the ability or the flexibility of payers to be able to quickly pivot and address employer needs with so many market competitive solutions. And I think the question is, how do we enable our clients so there's less of a need to go directly to some of these emerging players, and we're able to deliver more effectively at scale something that's market competitive in the market for our clients. So, I mean, that's in a nutshell, when we talk about what are the challenges that payers face, the ability to rapidly respond to the market in a way that's scalable and that makes sense, and from an overall strategy.
Impressive overview, Michelle. Thank you. So has this increased focus led to employers reevaluating fertility coverage or adding to it?
Yeah, I mean, first I would acknowledge, these are unprecedented times that we're in right now. And I mean, I think we're all aware of the general level of uncertainty that we face at a personal level with the COVID-19 pandemic. We anticipate clients are definitely more price sensitive, and they're looking, especially if they're looking to add a new benefit or to better manage an existing benefit. I mean, this is really one of the reasons why it's so important to have the right value levers in place to effectively manage care. That being said, we continue to see significant interest from the market on all fronts. Employers still want to add fertility benefits. They still want to expand their existing fertility coverage. They're looking to better manage their existing fertility benefits, or they're looking to add on those additional services like the FamilyPath advisor, who really take on that support role for employees on their journey to start a family. And in many cases, as we mentioned before, they're kind of looking at this and saying this type of support is more important now than ever to try to maintain their employees and patients' overall whole health.
Michelle, our audience may like to know, how are benefit designs different than in previous years?
Well, I mean, to start off with, there is much more of a demand for better integrated benefits. I mean, really based on our market feedback, we think that employers are ready to finally see solutions that solve some of the very real problems of medical and pharmacy integration. They are looking for designs that help demystify some of the challenges their employees face when navigating their benefit and add to their overall stress, right, during an already stressful time. To do that, we've really seen others move towards more of this cycle-based benefit where a patient's coverage is fully inclusive of an entire episode of care. So the benefit maximum may not be a dollar maximum, but focused on the rounds of IVF or the number of rounds of artificial insemination. And this is really helpful because members don't have to worry about running out of a pharmacy or medical benefit in the middle of treatment, and the confusion that causes and potentially disruption of a previously on-track cycle of treatment. That being said, even benefits driven by dollar maximums, which many payers and employers are more comfortable or familiar with, even dollar maximum fertility benefits can be better integrated and better managed to ensure that patients understand what is covered, what's not covered, as well as what to expect for anything that they would be paying out of pocket. And to give them a better sense as a healthcare consumer of what their experience will be. So in addition to these better integrated, more patient-centric benefit designs, we're also seeing interest from employers to make benefit designs more inclusive. So you'll see this in the move from more of an infertility benefit to more of a fertility benefit, for example. These employers, they're expanding coverage for donor services, elective cryopreservation, surrogacy, adoption. And really, to enable these benefit expansions, fertility solutions, they need policies that effectively address diverse populations. And then they also need to drive partnership and dialogue with clients around, exactly how their benefit designs impact their whole workforce. And the last piece here, in terms of benefit designs, it's really a reoccurring theme in the market right now. And that's that flexibility is critical, right? There's so many different needs in the market around family, about a fertility or a family building benefit. It's really critical to have a flexible offering. And that's one of the reasons why we focused on that as an inherent quality of the FamilyPath offering, is just knowing the variation out there in the market. And so we have a comprehensive turnkey solution, and we have more customizable configurations to meet the diverse demand that's out there. I mean, we know that employers and payers are both looking to simplify the benefits for their members, but there's also a need to broadly address the needs of the market, from state mandates to small, medium, or large employer groups. They all have a slightly different need.
Michelle, that is awesome. Thank you so much for your great insights regarding the fertility market. So Kajal, speaking of benefit designs, how important is integrating pharmacy management and care into a fertility benefit?
Hi, Julie. Thanks. I'm excited to be here to share that importance. So let me start with a little bit of background information. The fertility market is very fragmented. Members have a pharmacy benefit and a medical benefit, and they're left navigating this complex journey of understanding their benefit by themselves. And this can be a very overwhelming and stressful experience as they begin their family building journey or after receiving a diagnosis of infertility. Having an integrated benefit is important for a couple of reasons. The first is to simplify and streamline the member experience. That can be accomplished with coordinated clinical policies to streamline access to care. And what I mean by that is, with an integrated benefit, there's a single process to review and approve both the medical treatment and procedures and the medications that are needed for that treatment. Traditionally, a treatment approval is required, and then a pharmacy will submit for medication approval. The process is timely and can often take days in a therapy that is extremely time sensitive and can lead to delays as to when a member can receive their medications. What we don't want to occur is a delay resulting in postponement of a treatment cycle. This is absolutely devastating for a member. The second reason I'd like to mention is, in addition to simple, streamlined care regimens, offering a solution that is designed to be personal from the first encounter with a dedicated fertility advisor to help support members as they navigate this physically, emotionally, and financially taxing time is very valued by employees and employers looking for ways to attract and retain highly skilled employees. Fertility is complex, socially distancing, and extremely time sensitive. And streamlining the experience with access to a FamilyPath advisor who understands and can guide that member is invaluable for many reasons. The fertility advisor can truly enhance that member experience. Members are faced with numerous treatment options and providers to choose from, in addition to navigating what is or is not covered by their fertility benefit, as well as working with a specialty pharmacy. And for many, this will be the first time they're using a specialty pharmacy. The fertility advisor who is there to handhold that member through the entire process results in better outcomes with fewer member discontinuations of treatment. Supporting the member with a fertility advisor will provide a single point of contact able to evaluate the member's needs, where they are in their fertility journey, help answer any questions, as well as guide them towards the appropriate next steps. And for those members who are ready to start treatment, this would mean connecting the member to Freedom Fertility and continual follow-up to ensure that the member has everything that they need, all of their drugs have arrived on time as scheduled, The integration also allows for the advisor to have access to direct points of contact within the pharmacy who can provide real-time information and eliminate or reduce any barriers to achieving the best possible results, whether that's warm transferring the member to a pharmacist to obtain clinical information such as injection instructions, side effects, discuss side effects, or even working with Freedom to coordinate any same-day need, or actually even providing the Freedom team members benefit information to expedite medication shipment, which, as I mentioned earlier, is timely.
So, Kajal, why is pharmacy care so absolutely critical for fertility patients?
A managed pharmacy benefit is critical when it comes to fertility care is absolutely true. Where and when employees get their medications matters, especially when they may need as many as 15 prescriptions in a single cycle to address fertility challenges. Turnaround time from receipt of medication order to shipment can be measured in hours versus days due to the acute nature of therapy. Therapy lasts about only 10 to 14 days. This is one of the reasons why identifying and leveraging pharmacy providers who specialize in fertility is important to achieving the best possible results and to get the most value from the benefit. Freedom Fertility, the FamilyPath preferred pharmacy, has over 25 years of dedicated fertility expertise, delivering care, compassion, and peace of mind to patients undergoing time-sensitive and highly customized treatment. Care for patients at Freedom goes beyond just delivering medication. It's a reassuring voice on the other line that lets them know that we're here for them day or night to help them through what can be the most challenging time in their lives. There are a few critical aspects to pharmacy care that must be available for members. One, the ability to service same-day medication needs, which is inherent due to dose changes or carrier delays that could possibly happen. A pharmacy must be able to offer emergency same-day support to avoid interruption or cancellation of treatment, leading to avoidable costs for the client and the member. It's also essential that a fertility pharmacy is able to service nationwide, as clients have members located across the country, and the pharmacy needs to be licensed to ship to all 50 states. The other thing I'd like to mention is a focus on patient support and education, which is essential as many patients are taking their injections in the evening after their clinics have closed. Members should have 24/7 availability to a pharmacist who can help answer any questions they may have, including mixing and injecting, side effects, and storage as a few examples. Freedom provides access to a pharmacist 24/7, as well as access to multilingual injection training videos supplementary to their teachings that they received from their nurse, and as well as post their conversation with a pharmacist at Freedom. And the last thing that we need to keep in mind is that compounds are commonly prescribed as part of fertility therapy. In-house compounding capabilities ensure that a patient receives all medications in one box or package versus having to deal with multiple pharmacies, multiple packages, and a potential to miss a critical treatment window and potentially delay or lose a cycle opportunity, leading to avoidable costs for the plan and the member.
Thank you so much for really an in-depth and insightful response. Much appreciated. I'd like to share now with everyone the meaningful story of Megan and how times are really changing. This story shows the real-life importance of offering comprehensive fertility benefits. Megan always knew she wanted to be a mom, which is why when she reached her late 30s, she made the choice to pursue single motherhood alone. There are a lot of challenges that women face when seeking fertility treatment, but Megan's employee benefits, fertility pharmacy support, and her network of experienced friends helped her through her personal journey and to achieve her goal of starting a family. Megan had a comprehensive fertility benefit through her employer that covered both her medication and treatment, which is actually uncommon. Approximately 80% of patients who underwent fertility treatment in 2018 had little or no coverage. Megan said that she would have pursued fertility treatment, even if she didn't have access to the benefit, but it would have been a real financial struggle to make it through with the added expense. In all, she underwent multiple retrievals and 2 rounds of in vitro fertilization, or IVF, before finding out that she was pregnant with her son in October of 2017. The average cost of one round of IVF is roughly about $12,000 before the cost of fertility treatment. So as you can see, it can quickly add up, especially for those that require multiple rounds of IVF. Many individuals actually have to turn to credit cards or home equity loans or tapping their 401k to pay the hefty bills. Megan said that one of the most challenging parts of fertility treatment was keeping track and administering her fertility medication regimen. She found comfort and relief from the helpful experts at Freedom Fertility Pharmacy who were always friendly, responsive, and offered Megan education and medication administration. And sometimes Megan would need up to 6 shots per day and often wouldn't realize that she was about to run out of medication until a day or two before she needed them. Freedom Fertility actually leverages the Accredo Pharmacy Network to supply couriered same-day medications from 9 locations nationwide in order to service patients who need fast delivery. In 2019, Freedom Fertility coordinated 1,400 courier deliveries to these same-day locations. It's a common need due to the urgency of therapy as an indicator of overall success of a cycle. With Freedom Fertility support, along with Megan's network of friends who also experienced fertility treatment, she was able to confidently make it through the complex process. There are 2 things that Megan would tell others who are considering fertility treatment as a means to start a family. While it's a difficult process, it is absolutely worth it, and they're not alone in their journey. If there's one thing that we know for sure about Megan's desire to start a family on her own, it's representative of how the idea of the American family is really evolving. And listen to this. In 2018, 40% of births were to single people or unmarried couples. 50 years ago, that number would have only been 10%, according to the CDC. And a recent Express Scripts study found that over 60% of employers surveyed believe that they need to increase their fertility benefits in the near term. And that's because it's what their employees need. All right, let's hear from the audience. Thank you all for your active participation and for these thoughtful and terrific questions. I just read through. Michelle, I'm going to send the first question to you. And it is, if my plan already offers coverage for infertility, how is a comprehensive benefit different?
Yeah, that's a great question, Julie. Really, with a comprehensive benefit or with FamilyPath, for example, we can partner with you on options for expanding your benefit. So maybe you're looking for ways to increase the use of the benefit or the availability, applicability of your benefit across your broad, diverse employee population. We can partner with you to do that. Or if you have an offering today and you have clients that are very interested in that, there's services and things that we can bring to the table around adoption, surrogacy, elective cryopreservation to help enable that. We can also enable more effective management of an existing benefit. So if you don't have medical management in place today, we can provide medical management services. We have our claims services as well that can help better automate your existing benefit today and also provide additional value from a management perspective. And then the other piece is that we can help make your benefit more competitive with some of those third parties that are out there in the market and reduce the number of carve-out scenarios that you may see or kind of some demand for unique partnerships in the market. And we'll be able to better drive integration with you and provide some of those services like the FamilyPath advisors that you may not be able to have or support today. All as part of the solution. And that also includes the digital patient experience that's part of FamilyPath.
Excellent. And as a follow-up question, I see this. Does Evacore provide fertility benefits?
Great question. So we provide a comprehensive fertility solution. We partner with our clients on their benefits, on their benefit design. We're focused largely today in the ASO market. We're also partnering with our payers where they have mandated fully insured business. And what we do today is enable a fully comprehensive benefit. We provide effective management of the benefit to help drive and maximize the value of the benefit, and then also providing that, high level of patient engagement.
Awesome. Kajal, a question for you. Don't all specialty pharmacies service fertility patients? How are fertility patients' needs different?
Well, thanks, Jules. I'd say we need to consider what your meaning of service is first. Lots of specialty pharmacies have fertility patients that come to them, but do they truly service them in a manner that they should? Do they have the expertise and understanding required to service that patient? Do they know the time sensitivity and the need for a quick turnaround time required for this patient population, and the consequences of what that means for the patient if they don't meet both the patient and the provider expectations? So there are some important factors to consider when choosing a specialty pharmacy to fill fertility prescriptions, and I'll mention just a couple. In the fertility space, specialty pharmacies should operate only as a specialty pharmacy. This should not be an add-on service. Most specialty pharmacies place a fertility patient within the rest of their other specialty patient populations, and they follow the same procedures in how they process a prescription, which is usually days versus hours, which is what is traditionally required for fertility, resulting in delays in member abrasion. A solid indication that a specialty pharmacy is committed to fertility patients is the availability of dedicated team of coordinators, care coordinators, insurance specialists, and pharmacists with advanced training in fertility medications and treatments who can provide the expertise and compassion when speaking with a fertility patient. Plans should research a pharmacy's experience with fertility medications to ensure that it's not new to the field. At Freedom, even though we're part of a larger organization, the organization has made a conscious decision to keep Freedom separate from the rest of their specialty patients, and that's because of the service due to the unique service needs for fertility patients. We also should keep in mind that most fertility patients are otherwise healthy and need support and education, and the specialty pharmacy should have that available for their fertility patients. So what educational programs are available to help ensure patients take or inject their medications correctly? Self-injection is often a new anxiety-inducing experience. Patients may need to learn about things such as sterile technique, reconstituting the powder, preloading or priming a cartridge, drawing up the correct dose into a syringe, and preparing of the injection site. The specialty pharmacy should have clinical educators to go through the entire process with the patients in advance. And these educators should also make themselves available anytime to answer questions. Being able to watch the proper preparation of an injection is also invaluable. So at Freedom, we provide the patient the ability to speak to a pharmacist at the onset of their interaction with the pharmacy. And upon shipment of the patient's order, the patient will receive a customized email containing their MedTeach injection training videos for the medications in their specific package. So when I reference MedTeach, I'm talking about the injection training videos developed by Freedom that are an industry standard and used by many providers as well as patients. So in selecting the right specialty pharmacy, it is a critical step for patients undergoing fertility treatment. Accreditation, clinical expertise, customer support, and regional account management are all key things to look for when choosing a fertility pharmacy. By doing your research and weighing the options, you can ensure that the specialty pharmacy you select is the perfect fit for your fertility treatment.
All right, excellent. I think this is going to be the last question due to time, Michelle. Does Evacore have a network of fertility specialists?
Yes, we do. So as part of FamilyPath, you'll have access to a fertility network, fertility and lab network with proprietary rates that's proactively managed for quality to ensure that your members receive care from the highest quality providers that are out there. We also, we're very experienced at being able to ensure geographic coverage and fill any gaps that may be out there available. And to coordinate that effectively, we have the right teams in place to be able to manage that. And then from a quality perspective, which is just so important when you're talking about network strategy, but also specifically in the fertility space where there's so much variation. We use a combination of our medical and pharmacy claims information as well as information and as well as patient gathered information and patient outcomes to really create a holistic view of provider quality. And we use that to inform our reimbursement as well as our overall network strategy. So great question.
Terrific, you all. Thank you both so much, Michelle, Kajal, for your excellent responses and really valuable insight today. Matt, I'm going to hand the program over to you for closing comments.
All right. Thanks, Julie. Just a reminder that this webinar was recorded and will be available on demand at evicore.com/insights. We hope to see all of you at future events or future webinars as well. So be on the lookout for an email from us with an invitation to our upcoming webinars. And if you'd like more information on fertility coverage and Evacore's FamilyPath solution, please reach out to your client relationship executive or email sales@evicore.com. Thank you again, Michelle and Kajal, for sharing your expert knowledge with us today. And thank you, Julie, for facilitating the discussion. Finally, thank you all for your attendance and your insightful questions. This concludes our webinar. We hope you have a wonderful rest of your day.